When someone who uses methamphetamine regularly stops or cuts down on their use, they can feel unwell. This is called withdrawal. Withdrawal can include depression, anxiety, fatigue, agitation, reduced or increased appetite, issues with sleep, and vivid or unpleasant dreams. Withdrawal from methamphetamine is not generally life-threatening. The most acute symptoms can reduce within the first 7 days of withdrawal. However, the symptoms are so intense that they form a significant barrier to many people reaching their treatment goals. The easiest way to stop these symptoms is to use more methamphetamine, leading to cycles of repeated use, which can be hard to break. To try and help with this, we conducted a clinical trial of a medication called Lisdexamphetamine. This is a slow-release stimulant medication which is used to treat attention deficit hyperactivity disorder, or ADHD. We think this medication might help to control the withdrawal symptoms and cravings associated with withdrawal, at higher doses than have previously been used. However, this medication has never been used for the treatment of methamphetamine withdrawal. So before we could show it worked, we needed to perform a pilot safety and feasibility study to show that we could give this medication to people during withdrawal and it wouldn't make things worse. For this safety and feasibility trial, we provided our participants with a tapering dose of lisdexamphetamine, starting at 250 mg once daily and reducing it by 50 mg per day over 5 days. Participants for this trial were admitted to an inpatient withdrawal unit in Sydney and could stay with us for up to 7 days. We then followed up with our participants for 3 weeks after they left the hospital to check that there were no more new side effects. We enrolled 10 participants in this study, who were on average 37 years old, 9 of whom identified as men and 1 who identified as a woman. Our participants had been using methamphetamine for an average of 14 years before enrolling in the trial. In the 4 weeks prior to enrollment, our cohort used around 0.6 grams of methamphetamine per day on 23 out of the last 28 days. About half the participants smoked methamphetamine and half injected. We found that lisdexamphetamine was safe and feasible for the treatment of methamphetamine withdrawal in inpatient settings. While there were some side effects to this medication, these were all expected and mild. The most common side effects reported were headaches and trouble sleeping. People who participated in this study found the treatment to be highly acceptable in terms of medication effectiveness, side effects, and convenience. Although not designed to test whether the medication worked to treat withdrawal, overall withdrawal symptoms decreased through admission and remained generally low after the medication was stopped. This was similar with measures of craving for methamphetamine, which also decreased through the treatment and remained low at the end of treatment. While this study found that lisdexamphetamine was safe and feasible for treating methamphetamine withdrawal in an inpatient setting, because it did not include a control group, we still don't know how well it works to treat withdrawal. Future research is needed, and is already being planned, to conduct randomized control trials to test if the treatment works to reduce withdrawal symptoms better than a placebo. We also don't know if this would work for people withdrawing from methamphetamine at home, so that will also need to be tested in the future. We would like to thank Sam for reviewing the script, and the participants of this trial for giving up their time to try and help us find new treatment options and for contributing to this video. We would also like to thank the dedicated clinical staff at St Vincent's Hospital in Sydney for taking care of our participants. If you or anyone you know needs to speak to someone, call the National Alcohol and Other Drug Hotline on 1800 250 015.